Hi, I'm Madison.
Susie.
Janie.
Steven.
Reva.
Anxiety disorders are the most common mental illness in the U.S., affecting 40 million adults in the United States, ages 18 and older, or 18% of the population. Anxiety is a nervous disorder distinguished by excessive uneasiness and concern, typically with uncontrollable feelings or panic attacks. There are over 100 different symptoms of anxiety and anxiety attacks, ranging from headaches to heart palpitations. Anxiety disorders are the most common psychotic illnesses affecting children and adults. An estimated 4 million American adults suffer from anxiety disorders. Different types of anxiety are general anxiety, panic disorder, and social anxiety disorder. What are the symptoms of anxiety? People with generalized anxiety disorder display excessive anxiety of worry for months and face several anxiety-related symptoms. Other symptoms of general anxiety disorder include restlessness, difficulty concentrating, irritability, and muscle tension. People with panic disorder have reoccurring unexpected panic attacks, which are sudden periods of intense fear that may include palpitations, pounding heart, or accelerated heart rate, sweating, trembling, or shaking, sensation of shortness of breath, smothering or choking, and feeling of impending doom. Other symptoms of panic disorder attacks include sudden attacks of intense fear, feeling out of control, or worriness about the next attack. People with social anxiety disorder, sometimes called social phobia, have a marked fear of social performance situations in which they expect to feel embarrassed, judged, rejected, or fearful of offending others. Other symptoms of social anxiety are feeling anxious around other people, feeling self-conscious around other people, worrying about an event with other people, fearing other people will judge you, or having a hard time making friends. Evaluation for an anxiety disorder often begins with a visit to a primary care provider. Some physical health conditions, such as overactive thyroid or low blood sugar, as well as taking certain medications, can immediate or worsen an anxiety disorder. A thorough mental health evaluation is also helpful, because anxiety disorders often coexist with other related conditions, such as depression, obsessive compulsion disorder. How to treat anxiety. Anxiety disorders are generally treated with psychotherapy, medication, or both. In research studies, it is common for patients treated with a combination of psychotherapy and medication to have better outcomes than those treated with only one or the other. Psychotherapy or talk therapy can help people with anxiety disorders. To be effective, psychotherapy must direct at the person's specific anxiousness to his or her needs. A typical side effect of psychotherapy is temporary discomfort involved with thinking about confronting feared situations. Medications do not cure anxiety disorders, but often relieve symptoms. Medication can only be prescribed by a medical disorder, such as psychosis or a primary care provider. But a few states allow psychologists to prescribe psychiatric medication. Today we have learned about symptoms of anxiety and treatment of anxiety. Anxiety is a nervous disorder distinguished by excessive uneasiness and uncertainty, typically with uncontrollable feelings or panic attacks. If you have any or all of these signs, you may have anxiety or an anxiety disorder and can be evaluated by your doctor. Anxiety disorders are highly treatable, yet only about 1/3 of those suffering receive treatment. With treatment and medication, people with anxiety can maintain the symptoms.